Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, now on board with us here on the morning show. Dr. Joe, good morning. What do you have for us today?
Hey, Ray. How are you doing today?
I'm doing great, my friend. How can we not with this weather we have?
Retro weather, it's unbelievable,
I know.
isn't it? Oh, my gosh, Indian summer times 2 or 3 we've had this year. What a great fall. But everybody in the sports medicine world, is talking about Achilles tendon problems and rupture of the Achilles tendon. I mean, for people that were watching the football game of the Browns on Sunday, you could almost feel it through the TV. I mean, you could see that Achilles tendon rupture or pop. And so people were asking a lot of questions this week about Achilles. There's a lot of research written in it, too. So I looked at a lot of articles last night to kind of give just a snapshot about Achilles tendon ruptures. First of all, I want everybody to remember, and I've said this before, they're very rare in young athletes. Very, very rarely do I see this in my young athletes, junior high athletes, even high school athletes. Very rare. Now, I say that, and last year, one of the best spring athletes in the area, she tore her Achilles tendon. But I get maybe, in sports medicine, one every 5 years, or it's very, very rare. If I do, I start to ask questions, could these athletes have a medical condition where they have to take corticosteroids? Because one thing that really puts the tendon at risk for rupture is corticosteroids or injections of steroids. And so those are two questions we ask. There is even one antibiotic that puts the tendon at risk. It's called ciprofloxacin, that we try to avoid during this period of time when kids are in sports. But it's a real rarity in young people. And so it's more so with adult athletes. And everybody remembers and knows kind of a lot of the famous athletes. Of course, Deshaun Watson on Sunday that we all saw, but Kevin Durant, Kobe Bryant, Aaron Rodgers. People still watching Aaron Rodgers to say, hey, does he look like the Aaron Rodgers I saw 3 to 5 years ago? Nah, in my mind, not really. And that's the problem with Achilles. It's really hard to come back from. So traditional surgery, Ray, about 70 to 80% success rate for returning to sport. But at what level? A lot of times it takes 2 to 3 years to get back to a very high level, and many athletes still complain of a lack of explosion, the lack of the ability to push off. The Achilles is so important for those things, and it's very hard to get back. And sometimes it takes years, if ever, and that's only 70 to 80%. So, again, that high risk of if you get steroids, so do not consider a steroid injection. If people have tendinopathy or Achilles tendon pain for weeks or months, they're at risk to rupture. And if you inject them with a steroid, you really increase their risk of rupturing. So that's something we have to avoid, especially if they're in a high-volume sport. So let's go over a couple of ages really quick. The highest risk age is 30 to 45 years of age. And a few things about return. You can expect your athletes and patients to be standing or walking job. They could get back maybe at 4 to 6 weeks. To walk normally, maybe 3 months is the average. To go to low-impact hiking or walking, 6 months. So it is a long time, even for very basic things like hiking and walking. Not everybody has surgery. Many people allow it to heal. Obviously, then they lose a lot of that explosion and push-off. But if you're not getting back to any major sport, and so over age 65, 2/3 of adults do not have the surgery. They let it heal on its own and with physical therapy. So you know that we always want to kind of end with something pretty new because your audience is up on new things. So what's the new thing with Achilles tendon that I read about a fair bit with some of the research last night is what's known as the speed bridge repair. The speed bridge repair. Kind of made famous a little bit last year. Aaron Rodgers had that done. I did hear in some circles yesterday some people talking about that Deshaun Watson's looking at this accelerated repair. And this special implant to strengthen the repair looks kind of like an hourglass and really tightens up that Achilles tendon quite a bit more. So it may speed the return. It may increase the stability and the weight bearing. It's minimally invasive, a lot less invasive. But the problem is most surgeons were trained on the traditional, the 70 to 80% improvement, and that's how most people, not very many surgeons are trained on the speed bridge repair, and only if you're working with athletes and higher athletes might you consider the speed bridge repair. That came out in about 2014, and there's more of them now 10 years later, but that's kind of the latest thing that you'll be hearing a little bit about when pro athletes like Deshaun Watson, speed bridge repair. So that is kind of an overview of things related to Achilles tendon, Ray. What kind of thoughts do you have related to that?
I had a question, and Joe, I know you don't see x-rays, so it's kind of a difficult question for you to answer, but me only talking to you about Sports Medicine Center, but sports medicine the last 25 years, like you, I was watching that football game on Sunday. When I saw the heel go down, I said, oh, that looks like Achilles to me. It ended up being that. When you see that type of injury, and again, you haven't seen x-rays, can we expect to see Deshaun Watson back quarterbacking the Browns late next season, mid next season, or will it be a full year off?
We do see a lot of x-rays in sports medicine, actually, Ray. Of course, you know that's what we do, but not his x-rays.
Right.
And all that. This is one of the diagnoses left. You really don't need the MRI. They did it on Monday, I think, whatever, is I read an article about it. But you can actually see a gap in that big tendon in the back of the ankle. So you have them lie on their stomach. You squeeze the calf muscle, and typically the foot moves. And you squeeze the foot, you squeeze the calf muscle, no movement of the foot. You see a gap. You put your hands across it, and there's a gap there. You can diagnose this one without X-ray, without MRI. It's really pretty straightforward diagnosis when there's a complete rupture of the Achilles tendon. So it's probably one of the easier X-rays out there. A partial tear might be different. And again, remember, a lot of these people go into this, they have a lot of tendinopathy or scar tissue through years of being an athlete. And when they get that scar tissue, they're more at risk to rupture. So if you have somebody who's had a lot of Achilles problems with tendinosis, tendinitis, scar tissue, get them into physical therapy or they're at risk to someday be pushing off and rupture. And so you don't want people to be going around with Achilles tendon pain all the time. Get in and get some physical therapy done if you're one of those people before you rupture.
Joe, you mentioned hiking and walking. It's, basically 3 to 6 months, depending on where you are. Playing professional football is a different animal. I mean, you're running around and doing everything. Mid-football year next year for Deshaun or more?
Wait a second. You asked me that question, and I totally avoided it.
Oh, yeah, you were dodging it, my friend.
I was kind of like a coach up here, wasn't I, Ray? No, yeah, I think it's going to be very questionable by even mid-year next year. Very, very questionable about getting back very well. And I watch Aaron Rodgers play. He throws off the other foot a lot. He doesn't push off or explode off that foot. He's such a wonderful quarterback with his arm and his head, but it takes a long time to return. So in the Deshaun Watson question, I think very questionable that he gets back to next year to a very high level at all. That's how I would have to answer that question. That's my opinion, and as a sports medicine doctor.
Well, you have a lot of years' experience, my friend. I trust what you have to say. Joe, good stuff this morning. Thanks, my friend, for standing at the podium and answering those tough questions, Dr. Joe.
Thanks, Ray. Have a great rest of the week. Enjoy this weather we're having.